Nowadays, stem cell therapy is a promising approach for treatment of diabetes. However, it's important to note that stem cell therapy for diabetes is still in the early stages of development, and more research is needed to determine its long-term safety and effectiveness. Stem cell therapy for diabetes involves transplanting insulin-producing cells or stem cells that can differentiate into insulin-producing cells into the pancreas to restore insulin production. The goal is to provide a long-term solution to diabetes, eliminating the need for insulin injections and reducing the risk of complications. Several studies have shown promising results in animal models and early-stage clinical trials, with some people with type 1 diabetes experiencing improved blood glucose control and reduced need for insulin injections. However, there are still many challenges to be overcome, including finding the best source of cells for transplantation, ensuring long-term survival of transplanted cells, and preventing rejection by the immune system. In summary, while stem cell therapy holds great promise for the treatment of diabetes and even as a potential cure, more research is needed to determine its long-term safety and effectiveness before it can be widely used in clinical practice.